Hi, I'm Rich Daly, and this is FastFinance, your quick hit of the news and numbers that matter in healthcare finance. Up first, weird numbers. These are some random healthcare numbers that recently caught our eye. Today's weird number is 24%. That's the share of providers who did not receive the independent dispute resolution payment amount that they were entitled to within the statutory time in 2024. Those large unpaid awards come amid continued legal wrangling over the IDR process. Recently, the Supreme Court decided not to examine a circuit court's 2025 conclusion that IDR awards are not enforceable in federal court. Now for today's main story. A growing challenge hospitals and health systems will likely have to grapple with in 2026 is an increasing staff unionization push.
I think they just need to be on the lookout and see what's happening around them and keep their eyes open for the potential, because especially again in that Northeast corridor, there's going to be increased activity.
That was Joe Brock, president of Reliant Labor Consultants, which advises hospitals on labor issues. 2026 kicked off with a high-profile strike of 15,000 nurses from several New York City hospitals. One of those hospitals, Montefiore Medical Center, said in comments to FastFinance that the nurses' demand for a 40% wage increase and other benefits will cost it $3.6 billion over the 3-year contract. The increase would raise the average nurse base salary from $165,000 to $220,000. Its health system parent reported a negative operating margin in 2025, which was partially blamed on higher personnel costs across its labor contracts. Despite the massive dollar amounts involved, Brock said many strikes and unionization efforts at hospitals aren't actually about pay as much as failure to engage over non-monetary issues like insufficient staffing or schedule flexibility.
If they want to keep that union out, they come to the conclusion that it's good business to increase that work-life balance and the direct relationship that they have with their employees. So many hospitals that I get involved with don't care about that. They really don't. I mean, they say the words, but they just don't do it. And those places get unions.
Conversely, growing financial pressures have led some organizations to increase their appetite for taking on initiatives that may risk unionization or risk upsetting their existing unions. Another hospital advisor told FastFinance that he has seen an increasing number of examples where hospitals risked unionization in order to achieve cost controls. If done the right way, some organizations have been able to find labor-related savings while getting union buy-in. And now before we go, just one more thing. Beyond a high-profile legal battle over a rebate pilot, a range of changes are poised to hit the 340B program in 2026. The latest development came January 15th when Eli Lilly expanded its requirements for covered entities to submit claims-level data for their own pharmacies. That expanded earlier requirements that required such data for contract pharmacies. Other manufacturers are likely to follow this new policy, according to one industry advisor. Additionally, there are 4 other 2026 developments in 340B that finance executives need to watch. Those include the likely reissuance of a controversial 340B rebate pilot after it recently hit legal blocks. Also, hospital leaders will need to decide whether to respond to the coming drug cost survey from CMS. A third thing is that more state legislation was expected on both 340B contract pharmacies and provider reporting. And finally, federal legislation this year to overhaul 340B still remains possible, according to industry advisors. Well, that's all we got for today. Don't forget, you can get the FastFinance newsletter delivered right to your inbox every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.